Hey guys, this is Kimberly, and it is about 3:15 Pacific Standard Time on Sunday, December the 11th. I have been trying to make this video for the last hour and have just had interruption after interruption, so I have finally closed the door to the bedroom that I'm in, and I'm hoping that I can get through this. All I'm asking for is 10 minutes of peace and quiet, so let's see if we can speed through this really quickly. I just got out of the shower, and I am pretty medicated right now, so you'll have to forgive me if I have some slurred speech or if I don't use the correct words or stumble a whole lot. Probably about 30-40 minutes ago, I took my Percocet, so it's really starting to kick in now. I had intended on not making this video at the point when my meds were kicking in, but it just didn't work out that way, unfortunately, because of the drama that's going on in my house today with my children. But any parent knows that everything is unpredictable, and you just pick up and go on and try and do the best you can. So that's what I'm doing today. This video is going to be a little graphic, so I want to give a warning, because the last time that I showed my incision, I did not give a warning that it was going to be graphic. So today I'm giving you fair warning that if you are offended by seeing the abdominal area and close to the pubic area, there won't be any pubic area involved, however, but my incision goes from my belly button down to about my pubic bone. And I just got out of the shower. The incision is very clean. So I wanted to give an opportunity to show what that healing process looks like and what my incision looks like, so that anyone who is going to be having an anterior lumbar fusion will know what their incision could possibly look like. Every doctor does their incisions differently. Some are up and down, some are sideways, some are, catty corner, whatever you want to call it. So anyway, fair warning for that I'm going to talk about that in this video. I'm also going to talk about Candidia. Candidia is yeast, and it may be a topic that men don't want to listen to. So I'm going to start out with the incision, and then I'll give you a fair warning when I go to start talking about the Candidia, okay? So excuse my flabby belly. I have been pretty inactive for a year prior to my surgery. I have had 2 babies, and in 2007 I had a surgery that cut through all of my abdominal wall as a result of hemorrhaging. I almost died in that surgery, and so as a result, my abdomen never went back to what it was prior to surgery. I've always lived a very active life. I did Taekwondo for a number of years. I did kickboxing for a number of years. So even though I am not very fit now, I was at one time, and I really hate seeing my abdomen this way. So this is a humbling experience for me, and this is a very difficult thing for me to do. I've already shown it to you guys once, but now the steri strips are off, and I'm much more sober than I was the first time I showed it to you, so I had to say my little piece for my own self-esteem. So I'm going to go ahead and I'm going to move my laptop, and it's going to get a little shaky, and I'm sorry about that. And I am going to try and show you my incision. Okay? So, here you can see the incision up here by my belly button, and it goes all the way down, let's see if we can see that, just to the pubic bone, right about that area. It's a little bit jagged, and that is because I developed a post-op cough from the anesthesia, and I'm also asthmatic. So when I was coughing, this area was constantly expanding. I had all internal sutures and external steri strips to close just the external top portion of the skin. So, as a result, in the very beginning, the suture line was very straight. It was not jagged like it is now. But because of all the coughing that I did post-op, you know, because there were no sutures there, only steri strips, it spread a little bit and became jagged. And that's okay. I really don't care. And I am the type of person who I feel like when the time is right and I meet the right person and, you know, relationships happen, if that person loves me wholeheartedly, it's really not going to matter to them that I have 2 scars on my belly either. Because being a Christian, you know, I really believe that God brings people together who are meant to be together. And if it's in my cards that I meet somebody else in the future and get remarried, then so be it. If not, then that's okay. So my point is, I really don't care how it looks. But I wanted you guys to see it because, you know, this could be something that's traumatic to people who value the way that they look. And, you know, I mean, this is an altering thing. And it is something that's traumatic, and it's something that's overlooked. This is a scar that every day for the rest of my life I'm going to remember the fact that I broke a portion of my back restraining a violent patient. And I have to have faith that this is going to be a reminder to be thankful for all the blessings that I have in my life. So anyway, I hope that everybody can take something positive away from that, and positive away from not only seeing it, but from kind of getting a chance to see what my mindset is on it. So it's healing well. I think it looks great. The doctors think it looks great. That's that. So fair warning, now I'm going to talk about Candidia. So if that grosses you out, stop the video now. Don't continue to watch. As you all know, I was on 4 major super heavy hitter antibiotics when I was in the hospital. They put me on antibiotics that would treat gram-negative and gram-positive strains of microbes and infectious, you know, diseases. So, as a result, antibiotics have a tendency to kill the good bacteria, the good flora and the bad flora that's in your body. And flora is really important in the gut. And so because I was on so many antibiotics and I'm still on antibiotics, that flora is basically gone. So I'm taking a good probiotic and a prebiotic to help on the inside. But unfortunately, it has not helped on the outside yet. So it's a process. As a result, I've had an overgrowth of yeast that has affected both my front side and my back side on my bottom and my private area. For men, be prepared that you are susceptible to Candidia also after antibiotic treatment, especially if you're on it long term. I can't get into too much detail with that because I only have about 1.5 minutes left to talk. So I'm going to try and speed up and be really quick. But basically, you need to be eating yogurt every day. If you're on antibiotics, you need to also take a probiotic and a prebiotic. Those are the best things that you can do for yourself to avoid the situation that I'm in now. If you get into the situation where you do have yeast, it's red, it's itchy, it's burning, it will affect your anus, it will affect the entire skin area around your bottom, all the way up your crack, all the way down, all the way up the front. So you can treat that with over-the-counter medications. It's really not a big deal as far as treatment goes. Pain-wise, it is very painful. I was never susceptible to yeast infections before, so this is something totally new to me and something that has been very difficult for me because I've never experienced this before. And so some women are very susceptible, some aren't. I wasn't one of them. So anyway, that's my video for today. I'm sorry if it grossed you out. I'm sorry if it was too much information. But you know what? I am going to be blunt and straightforward and tell it like it is. And what you see is what you get. So sorry for no bra. Sorry for the flabby belly. Hope you enjoyed the video. I'll talk to you soon. Bye.